Dr. Jaden Durr, a physiatrist with ThedaCare Orthopedic Care, joins us now. Dr. Durr, welcome.
Thank you. Thanks for having me.
Can you just begin by telling us, what do you do? What type of patients do you see? What kind of care do you provide?
I see a lot of back and neck pain patients, and so I try to help navigate, trying to diagnose what they're coming in for, and once we find out the diagnosis, direct them to treatment options for them.
Okay. So we're going to ask you some questions. And these are questions that are often searched online, probably questions that you get from your patients, and we're hoping that you can address them for us.
Sure.
All right, first question here. When should I seek care for my back pain?
Back pain, it happens to a lot of us, but if it's something that's out of the ordinary or more than your usual ache and pain, or it's been going on for a long time, if you have associated numbness or tingling down the legs or arms, then that's something you should definitely see someone for.
Our next question, do women have back pain more frequently than men?
The short answer is yes. Based on the research, women go through a lot of changes compared to men. They have menstruation. Some women go through childbearing, pregnancy, and also they go through postmenopausal stage. And due to the sexual hormones being reduced after that, they are at increased risk for spine degeneration and increased back pain.
Should I see a chiropractor for my back pain?
I get that question a lot too. Generally, if the pain is not too severe, if it's kind of like a minor ache and pain, that's probably something that you could see a chiropractor for. Kind of similar to what you think of like a physical therapist. If the pain is pretty severe, you probably want to see your provider first before you see anyone like a physical therapist or chiropractor.
Okay. And our final question, what kinds of non-surgical back pain treatments are available?
So we always like to start easy, and with easy, I mean take it easy at home, rest, ice, over-the-counter medications. If that doesn't help, then probably see your primary care provider or one of us, either physiatrist or pain management, kind of see whether, something like physical therapy would be an option, sometimes chiropractic, or even prescription medications like anti-inflammatories, muscle relaxers to help with the pain. And finally, if it's still pretty severe, then sometimes we do injections.
What can people expect at their first appointment?
So first appointment, if we're meeting you new, we want to get a good history and physical. We want to know about what happened, how did you get this pain, where is the pain located, does it radiate anywhere? So there will be several questions about that. And then after that, we'll do a directed physical exam, whether it's for neck or back or shoulder. Depending on the diagnosis, it could be treatment options with sending you physical therapy or injections or medications, or we could be ordering more imaging studies such as an MRI or an X-ray to kind of get more information about your issue.
Okay. And all the care teams are located in one place, so it really makes it easy for the patient.
Yeah, so I have just 10 feet to the left of me and 10 feet to the right of me. I got the neurosurgeons on that side, so I can always ask them questions about an MRI or a patient. And then I got the pain anesthesiologists just to the left of me, and they're really good about letting me know on different options injection-wise that they can do. And so it's really nice that I can do that really quickly so the patient doesn't have to wait many days for a response.
How can people prevent back pain?
If you do a lot of physical work, you want to make sure you're using your postures correct. You want to make sure you're using your legs. You make sure you're using advantageous positions for your back, so you want to be as straight as possible. You want to maintain a healthy diet. You want to do regular exercise, and stop smoking would be another one.
Okay, all great recommendations. Thanks so much for being with us, Dr. Durr. We appreciate it.
Yeah, thanks for having me.